Now let us start our class, and so we start with the slides. So you can see the presentation here. Well, today we are going to speak about medications. And so this is Unit 5, which is called Dealing with Medication of the book. You remember, so you were given the task to describe some tests and procedures to prepare presentations. I've seen all your presentations. And today, during the third hour, we are going to listen to your presentations, just about the procedures. But first, now we'll start with the medications. Well, here on this slide, you can see the names of different drugs, and to the right, the type of drugs. And our task is to, the task is to classify the drugs according to their type. So the names of the drugs are here. So they are paracetamol, cyclizine, salbutamol, aspirin, amoxicillin, ranitidine, chlorpheniramine, and diazepam. And the types are antibiotic, analgesic, antiemetic, sedative or hypnotic, gastrointestinal, amphetamine, antihistamine, cardiovascular, and respiratory. So which of the drug belongs to antibiotic group?
Paracetamol.
Amoxicillin.
Yes.
Amphoxicillin.
Amoxicillin is antibiotic, okay. Which of them is analgesic?
Paracetamol.
Only paracetamol, or are there any other analgesic drugs?
Aspirin.
Aspirin. Yes. The next kind of type of drug is antiemetic and antiemetic, and which drug should we write here?
Cyclizine.
Yes, cyclizine, right. You're right. Okay, then so already Pradeep Kumar is coming. The fourth one is sedative or hypnotic.
Paracetamol.
Sorry?
Chlorphena.
Paracetamol hypnotic.
Diazepam.
Maybe diazepam.
Diazepam. Okay. Gastrointestinal.
Ranitidine.
Exactly. Ranitidine. Well, antihistamine. Which one is antihistamine?
Amoxicillin.
So this very long and
Chlorpheniramine.
yes.
Chlorpheniramine.
Chlorpheniramine. Okay. Then so cardiovascular.
Aspirin.
Exactly. Aspirin. And respiratory.
Salbutamol.
You're right, yeah. Salbutamol. Okay, the question is, so what are the benefits of each drug? What are the benefits of each drug? I mean, What are they used for? So if we start with paracetamol. So let us listen to Manish. What do you know about paracetamol and its benefits?
Paracetamol is like it is antipyretic, ma'am,
Mhm. Okay.
and it like it is used for the painkillers. It is one of the
Mhm.
safest painkillers.
Okay. So good. So Pradeep Kumar. Okay, cyclizine. This is for Rohita, please. Is Rohita here? No.
Yes, ma'am. Yes, ma'am.
Yes. Okay. So what do you know about cyclizine?
Cyclism, it is anti-sickness medicine, ma'am.
Mhm.
Like it stopped feeling nausea or vomiting.
Mhm.
Cyclism.
Okay, it prevents vomiting. Okay. So salbutamol. This is for Bhuvanesh. Is Bhuvanesh here?
Yes, ma'am.
Okay. So what is the benefit of this drug, salbutamol? What does it do? Why is it prescribed? So
Yes, ma'am.
we said that salbutamol is used as a respiratory drug. Yes. So what does
Yes, ma'am.
it
Type
do?
of respiratory from allergies of respiratory tract, mainly for some types of asthma and all. It will be used in.
Mhm. So it's used to solve problems with breathing, actually, right?
Yes, ma'am.
Okay. So the next one is for Sohita, please.
Yes, ma'am. Aspirin, it is a painkiller,
Mhm.
and it can also be used when a person is having a heart attack. They are recommended to chew an aspirin.
Okay, okay. The next one, please, Afnan. Is Afnan
Ma'am, he is
here?
absent.
Absent?
Absent, ma'am. It's quite positive.
See. Khadija? No, Khadija? I see. Musharafuddin? No, Musharafuddin. Yeah, I see. Mayuka, please.
Yes, ma'am. Amoxicillin. It is used
Methicillin.
for, it is an antibiotic used for bacterial infections.
Yes, so this is antibiotic. Okay, good. Then let us listen to Rina.
Yes, ma'am. Ranitidine.
So, what do you know about this drug, ranitidine?
It is used to treat ulcers, and whenever some like heartburn,
In the
burning in the chest.
in the chest, in the stomach, you mean, right? Okay. Well, then Bhargavi, please.
Ma'am, it is chlorophenamine. It is used to reduce the allergic reactions, allergies.
Okay. And the last one is for Vidya.
Yes, ma'am. Ma'am, it is used to treat and muscle spasms.
Diazepam, you mean, yes?
Yes, ma'am.
Okay, to reduce the the agitated feeling, yes. So Khadija is coming. Okay. Well, and if we move to the next slide, here you can see the logo of one of the agencies, organizations. What kind of organization is it? And what does it deal with? What does it do?
It's for narcotic drugs, I guess, ma'am. For the
Mhm.
drugs investigation.
So yes, you're right. Central Drugs Standard Control Organization of Ministry of Health and Government of India. Yes, it deals with the new drugs which are introduced in the country and developed in the country. And you see that there are a lot of similar agencies in other countries. And if we move here to the next slide, we can see that this is the information about regulatory agencies that approve the use of drugs in the United States of America. This agency is called Food and Drug Administration, FDA. In the United Kingdom, the organization responsible for drugs is National Institute for Clinical Excellence. This is like nice abbreviation. And for example, in Kazakhstan, this is the National Center for Expertise of Medicines and Medical Devices. So this is the short form is NDDA. Okay. So the agency is very important. They just play a very important role in approving,
Approval of
yes,
drugs
medicines, new
and
drugs.
clinical trials.
Yes, clinical trials also. Okay. And so apart from just drugs, brand name drugs, there are so-called generics. And here is the information about generics, as you see on this slide. So what a generic drug is? This is a medication created to be the same as an already marketed brand name drug. The same in dosage form, safety, strength, route of administration, quality, performance characteristics, and intended use. So we know that, so this word generic just started from medications. And if we think of generics and brand name drugs, what are the arguments for and against making generic versions of new medicines available in every country? What facts can you mention in favor of using generics? So who can speak about this?
I think for
Yes.
the generic medicines, it's low cost compared to the branded one. I mean, branded name drugs.
Mhm. Yes, one
It's
of
the
the
only advantage.
advantages. The only advantage, you think?
Yeah.
So the other students, what do you think about advantages?
Ma'am, it means that like the same version, generic means like the same version of the medicine.
So
Ma'am, I think the only use will be they will be modified. It will be the same, but like with the advancement of the new diseases, they will just be modified as per.
so it's easier to modify the generic than the brand name drug, right?
Yes, ma'am.
I see. Okay, and what are the disadvantages of using generics? Can you think of any
I
disadvantages?
think they are not effective as the brand name drugs.
Okay.
Affects the other drugs also, like same drugs.
Same drugs. Okay. So what are the disadvantages then?
Ma'am, I think people will not know about other medicines, other drugs if there's persistence to use only one kind of medicine, one company. They should
Mhm.
try other companies too.
Mhm. Maybe the patients are not aware of generics. They don't know about them. So, and they're afraid of just taking them because they trust to brand name drugs more, right?
Yeah.
Okay. So, and if we move to the next slide, we can see here the chart that compares several characteristics of so brand name drugs and generic drugs. So you can see that if we speak about an active ingredient, there is no difference. So it is the same in both drugs. As for the price, you were right. The price of generic drugs is lower. Insurance coverage. Does insurance cover the use of generics? So it covers the brand name, just drug, and also covers, if we speak about the United States of America, it also covers the generic drug cost. And inactive ingredients, if we speak about inactive ingredients, so as for brand name drugs, they are tested and approved by this agency, FDA. And as for generic drugs, they may the inactive ingredients may differ, but they are also proven to be acceptable by this agency, FDA. And as for strengths, how effective they are, and dosage, there is no difference. And appearance. Drugs, brand name drugs are standard in size, in color, and packaging. But packaging and the drug itself as generic drug may look different from brand name drug. So these are the main differences and similarities. Okay, and if we move to the next slide, we can see here the information about patients taking medicine, and there are some guidelines for prescribing any drug in the hospital. And the question is, why these are important and what might go wrong if we do not follow these instructions. So let us look at the instructions and so answer this question. Let's listen to Mayuka, please.
Yes, ma'am. Always consult the DNF when prescribing for the children. Consult your seniors when in doubt.
Okay,
Check
I
if the
mean,
patient.
if you comment only on the first one, why is it important? And what might go wrong if you do not follow this guideline?
Because children's are like they use low dosage, no, ma'am. If there is any difference of dosage, that might toxic to the children.
Exactly. Okay. So the next line is for Rina, please.
Consult your seniors when in doubt. Ma'am, we should take advice from senior that we should give or not to means children's about age, ma'am. Like below 10 years, below after 10 years, 15 years, like that. According to that, we should give tablets or any injections.
But seniors means your supervisors, the senior doctors.
Senior doctors, yes.
Yes. So why should you consult senior doctors?
To know means which dosage we should prescribe to childrens and to adults in that way.
To lower the risk right? So if you
Uh,
are in
yes,
doubt.
ma'am.
Okay. So the next is for Bhargavi.
Yes, ma'am. Check if the patient has allergic reactions to the drug. Yes, ma'am. It is important to check if the patient has allergic reactions because taking this drug, it may like if it could increase the allergies in that patients. So it is necessary.
And we should avoid this kind of drugs.
Yes.
Okay. Well, Vidya, please. Number 4.
Check if the patient is a responsible person. Yes, ma'am. It is important because if he is irresponsible, it may risk his health, patient's health. Like he may neglect the medications.
Exactly. Okay. So the next one is for Lahari.
Yes, ma'am. Check for alternatives to drugs.
Why should we check the alternatives?
Because
Why is it important? So think about the price of brand name drugs and, for example, and generics, alternative drugs. So which is more pricey?
brand one.
Yes, and here this is alternative to any kind of drugs. What can be an alternative way of healing? For example, can we offer a patient to change the lifestyle? Will it help in treatment?
Yes, ma'am.
Yes. Okay. So, and the question is, what are the guidelines do you think should be followed before prescribing on or off the ward? Can you think of any other guidelines?
That should not take overdose.
Sorry, will you repeat, please?
Ma'am, shouldn't take overdose of the medicine.
Okay, so overdose is
And
dangerous.
they should be taken like if the doctor advised to take 2 times, then they have to take only 2 times, not more than that.
Okay, so
Overdose.
you should follow what the doctor prescribes.
And also, they shouldn't stop because they feel all right. They should continue the dosage till a particular period of time.
Yes, especially this is true for antibiotics, right? So, okay. And if we move to the next slide, we can see here so some abbreviations which are used by doctors, and they're very common in prescriptions. You can see here the abbreviations to the left and their meanings. For example, if we have a look at the first one here, so PO, what does it mean?
By
Sorry?
mouth.
By mouth.
By mouth.
Yes, this is the Latin phrase peror, yes, orally.
As needed.
Yes,
As needed.
peros. Okay. Now, please, just let us have 2 minutes to match the abbreviations and their meanings. Do it individually, and then in 2 minutes we'll check. Okay. Make notes, please. Okay, so let us listen to Lahari, please. Can you tell
Yes,
us
ma'am.
the meaning of each of the abbreviations here?
First one, PO means by mouth or orally.
Mhm. The second one, Lahari.
Um, as required. PRN
Yes,
means as
so
required.
pure, and this is pro re nata, as required, okay? Stat, what does it stand for?
And stat
Stat, this is
in the
statim,
morning.
which means
Immediate.
immediately, yes, statim, immediately. Okay, OD,
OD means
it means omni die,
Once a day.
in Latin.
Once a day.
This is,
Once a day.
yes, once a day, every 24 hours. Mhm. G stands for
gram.
mhm.
Gram.
TT is
2 tablets. TT means 2
okay.
tablets.
And the last one, OM.
Is
In the
in the
morning.
morning. In the
Yes, this
morning.
is omni
In the
mane.
morning.
Omni mane, in the morning. So the Latin phrase for in the morning. Okay. And the next slide shows more just abbreviations. They are grouped into 3 groups, like the frequency of drugs, or often they are just taken, the route of administration, and measurements. Measurements, I think, are the easiest. Now, let us do it individually also. Just you are given, let us say, 4 minutes to complete this task. So make the notes, please. Okay, let's get started. The first line is about frequency of drugs. Let's listen to Manish, please. What do these abbreviations stand for?
ON is per night, every night, sorry. BD is twice a day.
Okay.
TD is thrice a day. QDS is 4 times a day. 4 to 6 hours is like we need to repeat it every 4 to 6 hours. And then 8 hours is for every 8 hours, and 1 to 4 hours is again we need to repeat again after 4 hours.
Okay, so these are abbreviations like they are. Why these letters are used? Because of the Latin origin, yes? We say,
Yes, ma'am.
oh, and this is omni nocte or BD, bis dier, or TDS, terdia semendus, or QDS, quarter dier semendus. Okay, good.
Yes.
Now, the route of administration, let us listen to Pradeep. Are you here? Pradeep Kumar? No. Rohita, please.
Yes, ma'am. IV means intravenous injection.
Okay.
IM means intramuscular injection. And
So,
SC,
SC, what kind of injection is it?
SC means subcutaneous injection. And PR means
This stands for per rectum, Latin phrase, and by the rectum, right?
INH means
Oh,
like it is inhalation, ma'am, like respiratory.
okay, like breathing in.
Yes, ma'am. NEB means like it is. NEB. I don't know. ma'am.
Who can help us with the last?
By mouth.
Nebulizer.
By mouth.
Yes,
By mouth.
nebulizer. By nebulizer, yes.
Nebulizer.
Okay, exactly. And now the management, the measurements, these Kuvanesh.
So first one is micrograms. Second is milligrams and milliliters.
Exactly. Okay. Yes. Now we can move to the next slide where you see this. There is some information in the chart, and we should say the abbreviations as complete words, and read each line as a complete sentence. So the example is given below. Like if we have a look at the chart, so the first column is the name of the drug, then there is dose of the drug, how frequently it should be taken, then the route of administration, and maximum dose for 24 hours. And the first drug which is given here is paracetamol. And the example says, give the patient 1 gram of paracetamol, 1 gram of paracetamol 4 times a day by mouth to a maximum of 4 grams a day. You see? So please, also a couple of minutes to you to write the sentences using similar structure. For example, with give or give up to a maximum of. So the sentences about the other 3 drugs which are given here in this chart. Write them, please. Well, we have less than 1 minute, and I think we will be able to check this task after the break, right? So we'll take a break for 10 minutes and then we'll continue.